Hi, welcome everyone. My name is Terry Wilder, and I'll be doing our kind of full welcome and introduction to our moderator today. I work for SAGE, which is based in New York City. We're the oldest and largest organization serving LGBTQ plus older people. And today we're thrilled to be co-hosting this webinar with the Office of HIV/AIDS Network, HANK for short. This webinar is the second in our series and will feature a panel of experts, many who identify as older people who will be discussing HIV prevention and sexual health in the context of aging. Our panelists will highlight the importance of ensuring that older people are included in efforts to end the HIV epidemic, including discussing the unique challenges and opportunities related to HIV prevention and sexual health for older people. We'll have a moderated discussion, which will address the unique social, psychological, and systemic factors for older people related to accessing PrEP, HIV, STI testing, and sexual health messaging. The session will highlight the importance of including underrepresented communities, again, especially older people in HIV prevention efforts and clinical trials to ensure more equitable healthcare outcomes. Our webinar will include a Q&A session, providing participants the opportunity to engage directly with our panelists. You can put your questions in the question and answer box at the bottom of your screen, and our moderators will pull those questions to share with Dr. Typhanye Dyer, who will then be able to ask the panelists your questions. Be sure to indicate who your question is for when you write your question, or if it's just for all, if you'll indicate that, that would be really helpful. If you don't see the question and answer tab at the bottom of your screen, you might need to go to the tab that says More and click it, and then you'll be able to see question and answer and click that so that it adds to your screen. So with all that, I'd like to begin by introducing Dr. Typhanye Dyer. Dr. Dyer is an epidemiologist and a health disparity scholar with over 25 years of experience researching HIV-related outcomes in marginalized communities. She leads and collaborates on multiple studies focusing on syndemics among sexual and gender minorities and Black women. As PI of an NIH-funded study, she examines the impact of synergistic epidemics on non-communicable diseases in Nigerian SGM, which is sexual and gender minorities. She also co-leads an area grant to mentor underrepresented undergraduates and a NIDA-funded pilot study investigating intersectional stigma and HIV outcomes in older Black women in the United States. And with that, I will turn it over to you, Dr. Dyer.
Thank you so much, Terry, for that wonderful introduction. Thank you so much, everyone, for joining us today for this session of inclusive HIV prevention and sexual health, HIV prevention, sexual health, and aging. So I'm really excited to really do the work that we're going to be doing today with our esteemed panelists, and I will introduce them now. Kenyon Farrow is the Director of Communications, where he leads AIDS Vaccine Advocacy Coalition, also known as AVAX, AVAC, their communications team, as well as their narrative change and strategic communications effort to help influence key stakeholders, policymakers, and the media to expand access to HIV prevention, supporting research and discrimination. Supporting R&D and programs and advancing global health equity. Kenyon previously served as the Managing Director of Advocacy and Organizing with PrEP for All, where he helped lead a policy coalition on a national PrEP program and led a campaign to make insurance companies accountable to pay for PrEP services. Awesome. Previously, Kenyon served as senior editor of thebody.com and thebodypro.com and U.S. and Global Health Policy Director with Treatment Action Group, or TAG. Kenyon has also been hailed for his work by numerous institutions, including Out Magazine's Out 100, The Advocate Magazine's 40 Under 40, The Roots, 20 Black LGBT Movers and Shakers, and Black Entertainment Television, yes, BET, which designated him a modern Black history hero. So we have Kenyon Farrow. Let's get a little wave. Thank you so much. Now we have Dr. John Wiesman. He has worked in governmental public health for over 30 years, starting in HIV counseling and testing and ending as Secretary of Health for Washington State. During that time, he co-chaired the Presidential Advisory Council on HIV and AIDS. He is now a professor of the practice of public health at University of North Carolina at Chapel Hill. This part is very endearing for me. John was widowed in February of 2024 when his partner and husband had of more than 36 years passed away unexpectedly. They had an amazing life together, and the loss led John to the motto of living forward with the memory and spirit of Ted and his journey of navigating back into dating at the age of 63, right? So now we're talking about aging and sort of getting back out and kind of what that means in terms of what we're going to be discussing today. Latonia Wilkins has her bachelor's in social work. She's the co-executive director of Project Red Paint, Inc. Latonia Wilkins is a dedicated advocate for health equity with a passion for empowering marginalized communities. As a facilitator, trainer, and public speaker with lived experience as a PrEP expert, she has co-presented at AIDS Watch 2024 and 2025, facilitated sessions at Synchronicity 2024 and USCHA 2024, and has also served as a contract facilitator for the Southeast AETC. She's a proud member of the PrEP Users Union and RX Reach or Reach expert panel. Latonia has been featured on Fox 5 Atlanta and CBS Morning News discussing PrEP accessibility and affordability. Her expertise is further informed by her role as a Greater Than HIV ambassador and as a participant in HIV prevention research. Hello, I didn't say hello, Dr. Wiesman and also Latonia. And last, we have Lisa Sutz. She's the Director of Special Programs at SAGE, where she oversees SAGE Vets, SAGE Positive, SAGE Trans, the New York City and South Florida Friendly Visitor Programs, and care management programs in Broward and Miami-Dade counties. Lisa joined SAGE after nearly a decade at DOROT, where she managed the Friendly Visiting Program and client assessments and supported a talented team of social workers. So say hello to Lisa. So that is our esteemed panel. Thank you so much for all of what you're about to give our audience today, which is the real. So why don't I just go ahead and start? And I like for people to just unmute themselves if they have something to say. So when I ask the question, I'm not going to call on a specific person right now. We'll see how that works. So let's start with, why are conversations around sexual health in the context of aging, why is that important?
I'll jump in as
Yeah, sure.
63-year-old. I think in part it's because we have sex and we are sexual human beings and we want to be living healthy and we want to have relationships of whatever sorts we are interested in. And in doing that, I think we want to be safe and healthy and have as much information as we can. So in part, it's about simply normalizing who we are and building that community and making sure we have the networks that we can get the information we need. And in terms of aging, that might be some of the health effects that might also come with aging that might impact our sexual pleasure or our sexual well-being, and being able to talk about those and navigate those paths.
All right. Thank you so much. Anyone else? Kenyon, we've got Latonia, Lisa.
He basically said most of what I would have said, but also I think that it is important that we are able to have these conversations without stigma with our providers, with our families, our partners, new partners, or whatever the case may be. I just don't think, I think that when we get a certain age, because even my kids be like, Mom, I don't want to know all that. You're not doing that, Mom.
Yeah.
So it's very important to let folks know that we are still relevant in this sexual nature.
Good. Thank you so much, Latonia. Okay. If no one else has anything to add to that one, we can just move on. Are we good? Okay. In terms of HIV prevention efforts for older adults, how well do you think we are doing in terms of current efforts? You can talk about if there's any gaps, any areas of improvement that you might think about in answering this question as well. So I'll ask it again. In terms of HIV prevention for older adults, how well do you think that we're doing in terms of our current efforts? Maybe we'll let Kenyon or
I don't think we're doing well at all in terms of our HIV prevention efforts. So, first and foremost, I mean, we still have, a lot of people or too high a percentage of new diagnoses every year are people over 50, which, it's almost like every year or two when the data comes out, everyone acts shocked. Everyone's like, oh my God, people over, 50 or over 55 or 60, 65, whatever the denominator is, oh my God, they're having sex and contracting STIs and HIV. And so um, instead of actually just kind of creating the kinds of programs and resources or whatever to support people. I know, Sage certainly is one really great example of which, but in general, especially when it comes to really talking about access to PrEP and PrEP services and the kind of like, social marketing and demand creation that you need, for older adults, like those kinds of programs are not often not available. And I, as somebody who's 50, I don't see, a lot of men my age in those, ads or commercials or whatever anymore. And certainly, there's few and far for women, for trans people, et cetera. So, and especially when we talk about folks who are aging. So yeah, I think we need to do a lot more in terms of our prevention efforts where folks 50 and over are concerned.
thank you so much. So Kenyon mentioned Sage, so I'm gonna toss it over to Lisa. Do you have anything to potentially add to that?
Yeah, I was going to say that unfortunately things are especially dire when we look at our Black and Latino communities. In New York City, in particular, in 2023, for people who were diagnosed over age 50, 83% of them were Black or Latino, which is really just inexcusable. So that is a further strain in which we need to be doing better. And that has just far-reaching impact.
Perfect, thank you. So maybe even targeting, just thinking, being more intentional about our prevention efforts. Thank you for that. Would any of you like to speak about your experiences with healthcare providers related to sexual health conversations and HIV prevention efforts? So that could be PrEP, PEP, DoxyPEP, and any of those types of the more biomedical interventions. Anyone want to weigh in on that? I'll ask again. Would you like to speak about your experiences with healthcare providers related to sexual health conversations and HIV prevention? Do you want to lob it back over to Dr. Wiesman?
Sorry.
Latonia's ready
Everybody
to
should
go.
just speak if they want to. I'm sorry about that.
Latonia, I think you are ready to go, so go for
Yes.
it.
So first off, I didn't learn about access to PrEP till I was nearly 50. Even, going to the doctor and sharing my experience of my partner receiving a positive diagnosis to HIV. No one mentioned PrEP to me in that initial conversation. And like I said, I was approaching 50 at that time. And all they told me was to keep coming in to get checked. And nobody mentioned PrEP. And PrEP was on the market at that time. I found out later. Then going to the doctor and being basically stigmatized because of my age for even asking for my PrEP to be refilled. I went to my gynecologist and I had been going to the public health department to get my PrEP. And I said, well, why don't I just make it, a one-stop, shop type thing. So I asked my gynecologist if she could refill my PrEP. And she was like, girl, at our age, we should know better. And I'm like, at my age, I do know better. That's why I am asking you to refill my medication. I did an article, you had mentioned thebody.com. I did an article in thebody.com talking about that experience, my experience accessing PrEP in general, and how I fired my gynecologist at that. I use it as a lesson to teach her about, her stigmatizing behavior towards me and, the ageism that I felt. And she was like, well, okay, I'll go ahead and feel it, girl. I'm sorry. I said, that's okay. I'll get somebody else to do it. And I just hope that the next person that comes in, that you do not make them feel this way, because they just might even not even seek help anywhere else. And that's happening.
Thank you so much for sharing that story. It's talking about you should know better. I think she should have known better than to have put you in that position and been that stigmatizing. I'm sorry you even had that experience. Anyone else want to weigh in? We had Kenyon, Lisa, John.
Sure, I can weigh in. And Latonia, sorry that you had that experience. And I think, again, part of this, which is unfortunate, is saying that a lot of times the patients need to be the ones who bring up these conversations or are more educated than their providers. And that is really not okay at all. And certainly as we get older, I think those conversations providers don't have with us is a real problem. So as Typhanye said, I'm 63 years old. In 1987, when I was in graduate school studying public health, I came to understand that I'm a gay man and was 25 years old at that time. About 6 months later, I met this man named Ted, who was amazing. We dated for 9 months and then moved in together. We were partners ever since that point in time and got married in 2009. As Typhanye also said a year ago, actually next week, my partner unfortunately died unexpectedly. He was 9 years older than me. And so, in my head, I always thought he would be the first to go, but I didn't know when I left work on Friday that I would be a widower on Monday. So when that happened, I certainly reached out to my friends and had a lot of support there. But I also knew that and I should say we were monogamous for many years, especially in the later years of our relationship. But I knew that I wanted to be sexually active again. I didn't know exactly when I would be ready for that, but I knew I needed to be prepared for that day when it came. So in part, I talked to friends who are gay, who I had trusted relationships with, about a number of things. Like, number one, how do you even date anymore? It's been 37 years. We didn't have apps back in my day. Like, how do you do this? And I also knew that when you're with somebody for a long period of time, and I was only out a short period of time before I met my partner, I didn't have as many sexual experiences as I might have liked. And also, like 37 years later, I'm like, who am I sexually? I've been with this person for so long, and we had a routine and we knew what each other liked. And, it was a limited scope. And I knew that I was interested in expanding that scope as well. Exploring some, bondage discipline kind of stuff, S&M a bit, in ways that I hadn't before. So I knew that it was important that I check in with my provider, and I knew about PrEP, and I knew about Mpox, and it was actually Mpox that I was first initially wanting to make sure that I took care of to get the vaccine. And so I did make a appointment with my provider to specifically talk about my sexual health. He's amazing. He was my provider and my partner's provider. We saw him together, so he certainly knew our relationship, and we had a great relationship with him. So I was able to get access to the Mpox vaccine and then talk to him about PrEP. And for me, so I started out, I was in the first group of people trained to do HIV counseling and testing in Connecticut. So I go way back. It also means my partner and I were the first to implement some of the safer sex workshops, right? And so for me, even being the co-chair of the Presidential Advisory Council on HIV/AIDS, talking about PrEP, the importance of it, I had to come to terms with it for myself. I happen to not be on any medications, which is kind of amazing at the age of 63. And the I had to like work through how I felt about taking a medication that I knew would help keep me safe. When there were also other options and get through my own sort of stigma of this. And so I talked to friends and my provider and really came to that point that doxy-prep was going to be right for me. And so when I was, about at the point where I thought I was ready to be sexually active, I made that appointment with my doc. We got me on doxy-prep. And I started that, and I started then exploring the very things that I was interested in learning more about. So that's my story.
So much for that.
Yeah.
Kenyon or Lisa, do you want to add anything or?
Yeah, I mean, I've been very lucky to a certain extent with my providers. Partly, which I mean, I think it has something to do with having, worked in this field a long time, having lived, in New York City and DC and places where there are kind of more infrastructure of, kind of LGBT friendly or providers who in fact are LGBT members of the LGBT community. And so that part has been easier. Where I've had the most issues with providers is when I have to step outside of that, kind of queer bubble of providers and then have all sorts of questions because a lot it's even happened. So I live in Cleveland, Ohio, which is where I grew up. I moved back here from New York in 2020, and um, dealing with most of what my experience has been with providers who just generally like have no clue about what to do. So just as one example, when I moved back to Cleveland, um, I had I had a partner, like a sexual partner in New York who like we're like our kind of like COVID moment, right? And when I got back to Cleveland, he texted me at some point and said, "Hey, I think like I was exposed to syphilis or whatever it was." Like I was like, "Oh, okay." Like, he had been during that period of time like the only person I was like having sex with. So I was like, "Okay, well, let me go check, but I think I'm okay." Went to an urgent care here in town, and the provider said, "Well, if you will test you and if you test positive, you're going to have to go make another appointment to the city health department to get treatment." And I was like, no way in hell is that like good public health practice. I said to her, that's not how this works. That's not the CDC guidelines. You're supposed to actually, if somebody says that they are known exposed to syphilis, like you treat them now and wait for the results right later, and you don't make them make another appointment someplace else in a different part of town. So she leaves. She says, "Okay." So she leaves the room, and she comes back like 5, 10 minutes later, and she has like the CDC guidelines pulled, like the PDF pulled up on her phone, and she said, "Oh my God, you're right." And she was like, "Well, we don't have the injectable, what is it, Bacillin A or the, injectable treatment." I said, "Then write me a prescription for doxycycline." And she was like, "How do you know that?" So it's just she was totally dumbfounded that like, so the I've had those kinds of experiences with providers who either just like don't know what they're doing around sexual and reproductive health. And what do you call it? In urgent care, which the joke I always say to people, urgent care is really like bougie STD clinic for people with insurance, right? So, like I'm clear that is how a lot of people, and I actually recently last year heard some data from Atlanta, the very high numbers of people coming to the urgent cares in Atlanta, Georgia, is STD treatments, is the majority of things that they're treating. So just like that connection of providers when you step outside of either LGBT specific or even like reproductive care, particularly for cis women, like then it's the providers outside who still have to see people around sexual reproductive health who are the most problematic. And if I were, younger and not an activist in this work, like some of those interactions, I would have left before I got the results, never returned, et cetera, not gone back for another, test or treatment should I need it or whatever.
Absolutely. Thank you for sharing that as well. And as well for you, John. Thank you for sharing your story. So my take homes are also what I'm getting from this is sometimes you got to advocate for yourself. We hear Latonia said that. We see Kenyon said that. Sometimes you just got to stand up. A lot of times we know more than the healthcare providers in some of these spaces. So kudos for everybody. Lisa, did you want to weigh in or it's up to you?
No, it's okay. I'll pass on this one.
Okay, that's okay too. Now, I want to remind everybody, if you have questions, put them in the Q&A because we're going to get to those soon. Okay, so do you think that the needs of older adults compared to younger adults related to HIV prevention, are they unique? And if so, why? Want to start us off, Lisa, or just want to pass the baton?
I think there are unique aspects, but there's more parallel than there is difference. I think sometimes we overemphasize the older part and underemphasize the adult part in ways that can sometimes be unintentionally a little bit condescending, right? When we think about just this conversation that we've had alone, the ways in which people are good at proactively advocating for themselves. So sometimes what happens is that prevention efforts are actually undermining the strength and capability of older adults. And that's the sort of the flip side of the not paying any attention to and not acknowledging the needs of older adults is that sometimes there's an edge of condescension of like, oh, you need younger people to help you with this, or we need to break this down in a way since you are older. Or things, the imagery when it does exist in prevention efforts tends to look like denture commercials,
Yeah.
which is, I think, wildly off-putting for everybody. So I think approaching people as adults first and also people who have a lot of lived experience is a preferable and more respectful way than approaching people as being so different because they happen to be older.
Wonderful. Thank you so much for that. I think when we had our meeting, you weren't there at that one. I don't know who said it, but at the outset, someone said people act like aging is some sort of like disease or like some problem or some outcome or whatever that you're trying to avoid. And it's like, if you keep breathing, okay, then you're going to get here. You'll get here. Did anyone else want to weigh in on that? Latonia, Kenyon, or John?
Like you said, my grandmother used to always say, keep a living, you will get old, right?
Mhm.
Uh, so my thing is, I think that there is still a lot of stigma in our generation, even talking about sex in general, let alone talking about, where to go to get any type of sexual health care. And so I think that, in my generation, we were shunned when we talked about sex. We were made to feel like sex was this dirty word and that, we shouldn't be talking about it unless we are married. At least that's my experience. So I really didn't get to a point until I was probably in my 30s where I was comfortable even talking with my doctors about my sexual health. And they aren't necessarily talking to you in a manner that would lead them to aid you in, different prevention mechanisms. They are talking to you like they are scared to have this conversation with you, or sometimes the language that they use is stigmatizing, like risky behaviors, which is a very, very stigmatizing language. And as a person, like I said, coming from a generation where we weren't even allowed to talk about sex as a natural human desire, we only talked about it as though in a negative context, unless we were married, and then we didn't talk about it because that's what's done at home and behind closed doors.
Gotcha. Thank you so much for that. Kenyon, are there any distinctions in our prevention efforts if we're looking at sort of younger folks and like aging populations?
Yeah, in some ways, I think they actually probably mirror each other, especially at the sort of, at the two extremes. So, I think when you're talking both about young people and also sometimes about, older folks, um, folks in both categories may not see themselves at risk, right? Slightly for younger folks, it's because we have terrible sex education in this country, and most people aren't getting comprehensive sex education, and certainly most cases, even with that, isn't like queer or trans inclusive. So people go through sex ed and still not understand, their, own potential risk. Number one, and I think for a lot of older folks, because we don't often talk to older folks about kind of sex and sexual health, then folks also don't see themselves at risk. So I think some of it is there. And then I also think that particularly when you get to more kind of older seniors, right, who are, we're talking like probably 70s, 80s, who may be in any kind of assisted living, or have, some in-home care or things like that, or also just relying on other family members, their kids, etc. Just say my mom and my stepdad are 73 and 82. And so me and my sisters are doing much more direct, like, stuff for them, paying their bills, managing, this, that, and whatever. And so, so just in those contexts, older people may not feel comfortable with, engaging in their sexual and reproductive care if like their kids are, looking at their medical bills, or they're in some kind of congregate living setting. And for young people, same, they're either living at home with their parents, or they're in college. And so getting PrEP prescriptions mailed to them or things like that may be problematic. So it's like, I feel like in those two extremes, there are actually probably some similarities, because people are at stages of their lives where they are less in control over like just being able to seek care or manage their sexual and reproductive health in particular kinds of ways. So in some respects, I feel like that's where I see some similarities more than I see differences.
Thank you so much. Before we move on with our panelists, Lisa, I'm going to give you the screen, and Lisa's going to give us a brief presentation, and then we'll come back to our Q&A, to our panel discussion, and then Q&A.
Thanks, everyone. Okay, is everybody seeing this? Great. So thank you. Just excited to share with you a pretty new development at SAGE. So just late last year in September, SAGE had the opportunity to launch a new initiative, the SAGE Center for Sexual Wellness and Aging, launched with the support of Aviv Healthcare. And Terry mentioned a little bit about SAGE at the top, so I will keep this very brief. But in case any of you don't know, SAGE is a national organization, although we are rooted in New York City and have some additional boots on the ground services in New York City. We do have a wide variety of things that we do, including advocacy and education efforts that apply across the board. So if you haven't had the opportunity to check out our website, that might be a good place just to get a little bit of a window. But a very large and proud organization that's been serving LGBT older adults for many, many years, because we saw that there was such a huge need and a desire for people to come together and build community. So that's what we're all about. So, what is and who makes up the Center for Sexual Wellness and Aging? And you'll see this picture on the left here is of a group of older adults that were gathered for one of our workshops. So the Center for Sexual Wellness and Aging was really an outgrowth of Sage Positive, which is a program that I have the honor of helping to lead. And Sage Positive dates back to 2016. And the root of Sage Positive is serving LGBTQ plus older adults who are HIV positive and potentially impacted by HIV. So helping people who fit into that category navigate programs and services and also find community, have fun together, all of those things, right? And so for many, many years now, Sage Positive has been running all different kinds of programming that has touched on sexual wellness and sexual health, right? At the intersection of all of these subjects. And there's been a real desire for many years to expand that and grow that and develop that and think of what it means to talk about sexual health more broadly. So that's really what the impetus was for developing this new center. So our mission is to create anti-ageist programming that is sex positive and affirming. So some of that programming, some of those activities certainly will be grounded in medical information. That's absolutely essential. But there are lots of places to get that information. What we really see as being more of our particular passion and unique niche is to talk about relational health and intimacy in a way that's broader and more holistic, right? So, in service of that, our particular focus is also on serving underserved communities. So, making sure that we have an eye towards TGNB health and also racial and ethnic and cultural considerations. The other part of our mission that's really important to us is making sure that we talk to providers. So bringing participants and providers together to have the kinds of conversations and education so that we prevent the kinds of interactions that we've all been talking about today that are so detrimental to people's health, well-being, comfort, and trust. So we're really working on fostering those bonds between providers and participants to break down those areas of discomfort and misinformation. So part of this grant that we've received from ViV Healthcare was to create a big ad campaign, which was really exciting. So we did that late last year with the collaboration and great support from M Booth Health. And what we created was this ad campaign that you see these 4 images for. And our focus was really on celebrating individuality, which you'll see in particularly, I guess, in the one that says "Come as you are," while also really celebrating community, which you'll see in some of these other images. We wanted everything to be inclusive and fun and really talk about sexual wellness with older adults in a way that was unique, eye-catching, and would draw people in. So it was very exciting. We had these ads appeared in 2 subway stations in September and October, High Street and 14th Street, 6th Avenue. And actually, if the MTA didn't have enough billboards in some of their other stations, they put them in the other stations for free. So one day I was getting off the train up here in Inwood, and I said, "Whoa, I saw one of the images." So we actually got even a broader viewing than we had anticipated. And the response to these has been absolutely wonderful. A lot of people feel very connected to the images. And in conjunction with this, we had a launch event where we brought together some providers and participants to talk about their experiences and to talk about what we don't talk about often enough. And we did a comprehensive survey to get a good sense from people of what do you want to know about, what do you want to talk about, and also what kinds of formats are helpful. So we use this information as one really great source of data that has shaped the programming that we have led so far and what we'll be doing in the near future as well. So we have the great opportunity to work with a lot of wonderful professionals, healthcare providers of all kinds, community leaders, mental health professionals, dating coaches, you name it, the full spectrum, artists, writers. All of these people are experts, experts in a field and experts in lived experience. And our goal is to really honor both of those things and not to see them in a compartmentalized way. So we ask people to bring their full selves to these programs, events, workshops, and discussion groups. We also do have support groups that are really positive and helpful. So what's coming up? You'll see here, there's a flyer for something that's actually just happening this afternoon. And then tomorrow, Friday, yes, tomorrow is Friday. Tomorrow, I'm going to be doing a presentation at the Sage Center in Brooklyn for the Seniors Sexpo. So it really is the broad spectrum. We have some dating events for women coming up. Sexual health and cancer is something that we've been thinking about a lot. And so we have some things in the works about anal and rectal cancer and also about some gynecologic cancers. So we are thinking about this broadly and really excited to continue building this community and bringing more people in. So if you're interested in learning more, please don't hesitate to reach out. And as I mentioned on the Sage Serves website, there's a little bit more information and a way to sign up for a newsletter. So thank you so much for your time and excited to share.
Thank you so much, Lisa, for that
Thanks.
I love the work that you're doing. That's really awesome and fun. I like that it's kind of a fun kind of vibe that I'm getting from it. So thank you so much for the work that you do. I'm going to take a couple questions from the question bank. So then, we have our basket of questions, but I really would like to get some of the questions that some of the audience wants to have answered. So the first one I have is, can a male with diabetes and complications, such as neuropathy, ED, can they safely take PrEP, if anyone knows this information?
Just with a preference that I am not a medical doctor, so you should consult your medical provider about that question. But I will say, having seen enough studies and looked at the data, see your doctor, but because certain medications, and I don't want to promote any company or whatever, but just to say there's certain medications are potentially more may have more impact on your kidneys. And so that's why you want to kind of check with the provider about which PrEP option you should take. And again, even the kidney risk with TDF-FTC brand name Truvada is very rare, but it does exist, and certainly somebody with kidney issues, I would probably say, should think about some of the other possibilities. So I would just check with your provider on that question. So it's not a flat no, but you're based depending on what your particular medical situation is, they may steer you towards options that will be potentially not come with far lower risk of any adverse kidney issues.
Thank you for that. Thank you so much, Kenyon. We have another question. And so this is like a real panel-y kind of questions for everyone. Someone would like to know, or they thought it'd be interesting to have the panelists specifically talk about their experience asking for or being offered HIV testing. So this person does have, says they have people over 50 that tell them that they are refused testing because of their age, so ageism, or for other reasons. Interestingly, nobody has ever offered me an HIV test, and I always have to ask. So what does that landscape sort of look like for aging populations with respect to just, I need an HIV test? What does that look like for our panelists can anyone can chime in. Dr. Weiss, Dr. Wiesman, got Kenyon,
So I guess for me personally, in my maybe annual checkups or when I would go in more for a wellness checkup, that would be a topic that would come up. And knowing my history, I was able to answer whether or not I felt like I really needed that. So again, in my case, good relationship with the provider, a very well-informed provider would raise that as part of my general care.
Thank you. Anyone else, Kenyon? Everyone can just go.
Yeah, I was gonna say it's always for me whenever I establish a relationship with a new primary care physician to have that very in the first conversation that you are A, having sex, B, interested in, regular HIV tests and or PrEP if that's something that you're interested in, so that you establish, you get them in the routine from the very first meeting that this is something you're going to need, at, whatever intervals. Second thing is, and then if you have a provider for whom has responded negatively or dissuaded or outright refused, I would again take earlier, I think Latanya's advice that you fire that provider and find someone who works for you. Third thing is, you can also get HIV tests not from your provider, right? You can go, if there's a local community-based organization that does either HIV or as I have gone to Planned Parenthoods as a cis man and gotten HIV tested when I needed to. So I would also look at some of those other options, and they're now also take-home tests. Like they're a little expensive, but you can, order them from, a bunch of sites online and your local pharmacy. Some pharmacies actually carry them in stock. So there are a bunch of other options to get HIV tested. But if I had a provider who's my regular provider who refused, then I would be finding another provider.
Thank you so much for that.
I never had so much on the refuse to give me a test side. It's just because HIV testing in most states is an opt-in option instead of an opt-out. I'm not even offered the testing. So I have to ask for it. And even when you ask for the test, they were like, well, have you been engaging in any risky? Why do I have to go? I'm asking you to test me because I have a right to be tested. I don't need to go through the whole list of your stigmatizing questions. And I have actually advocated to have that change to make HIV an opt-out option so that people don't have to go through the stigmatizing questions of, well, why do you need the test?
Thank you so much for that. Okay, we have another question. How can we improve and sustain equitable access? Whoa, that moved. Okay, where did it go? How can we improve and sustain equitable access to HIV prevention, treatment, and overall sexual health for older Black, Native, and Latin adults, particularly in the face of new challenges to past efforts? New challenges to past efforts. We're talking funding, we're talking not having a specific focus on Black, Indigenous people of color. Any idea of how we can improve and sustain that access to everybody, but really communities that oftentimes are not involved in some of the conversations?
Yeah. I think we're gonna have to get real creative, right? And wonder if going back to focus on primary care providers as potentially being better sources of information and potential sources of testing, since they are less likely to be um, flagged as concerning providers, or by there might be some strategic movement that can be done for working with providers who are less likely to have funding threats and other, I think this is developing, but I think we're going to have to get real creative about how things are framed, what is said, and building collaborations in order to get things done.
Thank you for that, Kenyon.
Yeah, we're gonna have to fight like hell, right? Like, so let me just get straight to the point. We're gonna have to fight for it. So, and that includes several different strategies. So one thing that I'm thinking about this as we're sitting here, and RFK Jr. was just confirmed as the head of HHS, which, if you don't know, Health and Human Services is over the National Institutes of Health, which is all the research. It's over CDC, which is about prevention implementation. It's over FDA, right, which is about drug approval. And we have a new PrEP option, twice a month twice a year lenacapavir, which is currently under FDA review. So and then we have a legal case making its way to the Supreme Court that would gut the Affordable Care Act protections for preventative health services that providers could deny people access to PrEP, to other things that are preventive services for religious exemption reasons. So that's the landscape that we're in, and we're going to have to fight. So I think on an individual level, yeah, it is about trying to make sure maybe it's the kind of working with your providers or your clinics or wherever to make sure that, they're also thinking about, and I would start asking your providers those questions, especially if you're in a non-Medicaid expansion state or a place where PrEP services are often a little more difficult to get. I would start those questions now. Second thing is, as people over the age of 50, and especially senior citizens, so much of what happens in terms of like conservatism in this country happens on the logic is often older people are often used as the reason why we're passing a bunch of like regressive laws. They either talk about protecting children, or they also rely on what they assume is a base of senior citizens, of people who are older, who are going to be more conservative and consent to their BS. So I would start now calling your representatives and talking to them about, this person I know was just confirmed, and these are my concerns about access to, HIV prevention, other sets of healthcare, vaccines, et cetera, whatever it is you're concerned about. Start those calls now, because, and I don't care if you have, the most right-wing conservative offices as your representatives, call them anyway.
Kenyon said we might have to squabble up, so
You got to squabble up, right?
I'm hearing it.
The HIV movement has gotten too nice, if you want to
Yeah.
ask
John, did you want to weigh in?
Yeah, I would echo what Kenyon's saying and sort of say we're not going away, we're not going to be erased. And attending town halls, being there physically. I just got a call last night, which unfortunately I couldn't take, for a town hall where they call you and saying, we're having a town hall in 10 minutes, please, So take those opportunities, put your questions in, don't let it go by. The other thing I would say, we're going to have to support our nonprofits as well. Those who are, community-led, community serving. We're going to have to stand up and support them, and also fight for their rights to receive funding, and say we're not going away. We're going to have to be more visible.
Right. Thank you for that. One more question, and this is for everyone. The person says, I know that organizations like SAGE have worked hard to get the CDC to remove the upper age limit in their HIV screening guidelines. It got close, and then we have this transition in the White House. So can you talk a little bit about why it's important to remove the upper age limit in the CDC HIV screening guidelines? Anyone can answer, like, what's the import of that? From 13 to 64 to 13 and older. So there's no cap.
We still have sex. There are ways that are saying there are medications and lifestyle changes that are enabling us to continue to have sex at later ages or stages in our life. And to be exempt from something that could help us to manage our sexual pleasure, more healthy, is problematic. I think that someone had mentioned about the cases of people who are aging, contracting STIs that are in assisted living facilities, and just in general. Someone had put in the chat that us aging folks are coming in by the numbers to get tested. Because nobody is offering those tests to us and not even giving us the option to say we don't want it.
Thank you for that. Anyone else?
I'm
Okay.
actually having the best sex of my life
I am
over 50.
listen,
To tell you the truth,
speak on
I'm
it.
not worried
Speak
about
on
having
it
kids.
today.
So I need to be able to navigate that as pleasurable as possible, as
Yeah.
healthy as possible,
Yes.
and pleasurable.
Lisa?
Yeah, I was just going to say that also not having the testing is a major contributing factor to people um, being diagnosed in later stage disease when they are diagnosed, right? So there's that practical component, and there's also the component of having that conversation and having testing broadens a discussion about sexual health, sometimes about other things as well, about the nature of one's romantic partnerships, if there's a domestic violence situation, right? Not encouraging and recognizing the humanity that encompasses one's sexual life and sexual needs shuts so many doors and is just really limiting. So there's the practical piece, which is imperative, and there's also sort of this bigger piece of what are we saying about about people that once they pass a certain age, then they are essentially less than and discarded, right? Let's that's built on absolutely nothing, and does a disservice to older people and also to younger people who have so much to learn from their elders.
Hey, that's right. Anyone else? Nice. We'll go back to the question bank. Are you aware of any resources that are currently available to older adults related to sexual health and HIV prevention? Any resources that people might be able to tap into to sort of be healthy? No, well, that's
Yeah,
that's on the fly. Okay.
I was going to say, I just put in the chat a um, website, and it's totally free, totally easy, at-home test kits. You just put in your information, and they mail them to you. And every few months or whatever, they'll come back to you and say, "Hey, it's been a while since you've ordered anything. Do you want more?"
Perfect. Thank you so much for that. Someone asked, and they specifically asked of me to ask this to Kenyon. Can you share quickly? I mean, I know we talk about PrEP, we talk about PEP, we talk about DoxPrep, we talk about, and some people aren't sure what we're even talking about. So can you just, and I know that, someone asked and then somebody put in a link and then somebody put in another link. Okay, everybody can click links, but we're at this forum, we're at this, this panel discussion for a reason. So instead of sending them to a website, they can do that later. But right now, can you give us a little bit of what PrEP is for people who might not be familiar with it? And that's for everyone, but it was specifically for asked of Kenyon.
Okay, sure. So PrEP stands for pre-exposure prophylaxis, right? Which is basically a way to say that we now, since 2012, so we're now in the 13th year of having this available. So PrEP is a um, drugs that people can take that prevent HIV. So one way to think about it is like the kind of think about birth control, but think about it in terms of preventing HIV instead of pregnancy, right? So that's kind of one easy way I kind of give people to think about it. And now, so we initially started with one medication that was one pill a day. And there's currently now two medications that are one pill a day. The first one is now generic, so which is what I'm on, and I mean, so much cheaper than the brand name drug. So they're basically two medications that are pill forms per day. There is one injectable that you can take every other month. So it's a shot in your behind every other month that will prevent HIV. And there's a new product that's under FDA review, which is a shot that's twice a year, that you would only need to get 2 shots a year in order to prevent HIV. So PrEP is the, HIV prevention medication strategy, right? So there's that. When we talk about doxypep, when you hear people talk about doxypep, what we're talking about is the drug doxycycline, which is an antibiotic. And it was discovered a few years within the last decade, roughly, that taking that medication within 24 hours, roughly, of having a sexual encounter is highly protective against contracting syphilis, chlamydia, and gonorrhea. But gonorrhea, to a lesser extent, gonorrhea is a little trickier. But it definitely prevents. It can still be helpful in preventing gonorrhea, but it's far better at preventing syphilis and chlamydia. And so that's something else that people is now approved for use for preventing STI, sexual transmitted infections, as well as one of the tools that people use to treat once people test. So now we have sort of those two tools, one, to prevent HIV, and now, a medication people can take just periodically to prevent STIs as well. And I'm also a doxypep user in addition to PrEP.
Perfect. Thank you. Anyone else?
I think Kenyon
Yes, go ahead, Latonia.
explained it pretty well. I think it's also fair to note that only one of the pill forms, both cis identified male and female can take, and the other one, only one of them, both can take, and the other one, cis women cannot take. So it's important to note that as well. He mentioned the study drug that they are trying. I'm currently utilizing the study drug due for my second injection in April. And I'm loving it, not having to remember to take a pill every day. And so I'm fiercely hoping that it does get approved by the FDA firstly, and then secondly, that it's accessible. Accessibility is big. It's something that I advocate for 367 days a year. Accessibility, because that it's important to note that not everyone has access to the drugs that Kenyon just mentioned, or easy access to them. People will say they're out there, but when we talk about accessibility, we talk about different things like being able to have those resources nearby where you can get them, and all of those things. So it's very important, like Kenyon had mentioned about, we're going to have to fight and go and vote and talk to your legislatures and all of that. These are things that we have to think about when we're in this fight. Sorry.
Yeah, and advocating for the accessible cost of some of these, because the newer drugs tend in general to cost more, and the injectables, et cetera. So making them accessible is also making them financially accessible.
Thank you so much.
Yeah, because when you think about the current study drug, right now it is being utilized as a treatment drug for HIV, and the cost per year for one person is averaging about $40,000 per year. No one can afford that medication who's not the working class poor. We can't afford that. So that's why it's important to talk about, the cost being an accessibility barrier as well.
Thank you. Perfect. We have time for maybe one more question, and then we're going to give our final thoughts from our panelists. This is okay. Do you think that the lack of focus and funding for sex education for older adults is related to an interest in, because Kenyon, you did say like prevention for prevention's sake versus like birth control. So is it related to an interest in birth rates versus actual sexual health? I'll ask again. Do you think that the lack of focus and funding for sex education is related to an interest in birth rates versus actual sexual health? That's a tricky one.
It is. I'll try it first. I mean, I think that the to me the lack of, sex education, if you will, for people who are older, I
Mhm.
think it's less to do, maybe a part of it is about like the, assumptions around, fertility, I guess, and having kids at, older ages, though people are doing that now. And more just about, I just think in general we have terrible sex ed in this country. We're not even doing it good in schools where we have captive audiences, if you will. So, and I think that in general our society kind of functions in a way that is like, oh, once you graduate from, high school or college, you're done learning, right? Like like we don't actually really promote or talk about the process of learning as an adult and even as an older person. And certainly an assumption that after you reach a certain age that you're done learning anything. And so I think that to me is the bigger problem. And embedded within that is also the assumption, right, that older people aren't having sex or what have you. But as far as just from the basic kind of education standpoint, there's nothing else we really do a lot of education with older adults around, like very little. And so I think, one, I think that we have to obviously deal with the stigma about having sex at over a certain age or whatever. But I just think in general, we kind of have a culture that assumes that after people are 18 or 22, that you're on your own and there's no other kind of pathways to learn things or need to kind of learn and kind of stay engaged in things and have very few infrastructures to allow that to happen at older ages.
Thank you. I'm going to go ahead and, so within your wrap up, if you want to sort of address briefly what the question was, that's fine. But I want to ask our esteemed panelists if there are any final thoughts, any closing thoughts, anything you want our wonderful audience to go away with today, something to chew on later, something to think about. Any closing final thoughts from, I'm going to go down my screen. John is right next to me, Dr. Wiesman.
Thanks for that. I would just say thank you for joining us. It's important that we have these conversations, that we're willing to talk about sexual health, talk about sexual pleasure, be informed and engaged. So I think your homework from here is to go out and talk to others and advocate, as we said earlier, advocate for the programs that are needed, the services that are needed, and stay healthy and do something that makes your heart sing today.
I love that. I love it. Man, I'm gonna take that with me all day long. Kenyon.
Damn, I gotta follow that positive message.
All poetic. Go
I'm
ahead.
not usually that kind of girl. I'm gonna give you the hard medicine. I mean, I'm gonna say, like, I know what we're living through, a really intense and frightening time. I said this in a TikTok video recently that but don't let the onslaught of information, which is definitely designed to overwhelm you, but it's designed to overwhelm you so that you check out and stop paying attention. And so, I'm encouraging people to figure out the time and space you need to take care of yourself. Obviously, go out and do things that bring you joy and passion and love and et cetera, and connect you to folks, but also pay attention and also be ready to join in folks who are doing work to resist the onslaught that we are currently just at the tip of.
Yes, thank goodness. Latonia, any closing remarks, anything, like I said, you want people to take with them today as they go about their day?
I was going to be comical, but I'm gonna be
No,
serious.
no, come on now. I love.
I was going to say that sex is great cardio. Why not ask your doctor for the supplements you need to engage in your pleasure?
Listen, think about it. That's not comical. That's real. I mean, I know I get what you're doing. I get that's real though.
I am so, yeah, sex positive. So
I love it. So get out there and get what you need. If, you have to kind of know what you want, get what you need. Lisa.
Yeah, I guess I would just encourage us all to be curious, to ask questions of the older people around us, and to really engage in conversation across generations. So, whether that be, a person in their 60s seeking out conversation, connection, and learning with a person in their 80s, or a person in their 20s with a person in their 70s. I think too often society is structured in a way to really pit people against each other, and that is such a disservice to all of us. So let's keep on talking, remaining curious and compassionate, and learning from each other.
Wonderful, wonderful. Okay, well, if we don't have any more questions, I want to thank I keep saying esteemed panelists because you are, for being with us today and really imparting on us your wisdom, telling us your personal stories a lot of times, and then just sometimes being even vulnerable in a space where, you're sort of advocating and representing a certain demographic of folks. Um, so we've got ask questions, we've got ask for what you want, even if it's a supplement for, and just remain curious, right? And so those are some of the things that we want you to take with you today and just throughout. And don't forget, so this was our inclusive HIV prevention and sexual health, HIV prevention, sexual health, and aging. This is the second one. I see a little 2 right here. So we keep the conversation going. This hopefully I can't say this is not my job. So I can't say, we'll have a bunch of these forums. We're like, no, Tiffany, it's the last one we're doing. But
Actually, we'll have another one coming up.
okay,
We're
good, right?
starting to plan it.
Okay, awesome, right? Because these conversations have to keep going. Otherwise, we go on to our little silos, and that's where we stay. And so I hope we were able to answer all of your questions and sort of pique your interest and inquisitiveness in this space. And I hope you really had a wonderful time. I know I did. So thank you, everybody. Thank you, Terry. Thank you, Russell. Thank you, Murph. Thank you, all of you, for really making this a really wonderful experience.
thank you.
And that's it. Okay.
Thank you, Dr. Dyer.
Oh, I mean, and I learned some, I do HIV research, you know what I mean? But it's just like I learn about my own self when I'm on these panels, you know what I'm saying? So that's all good stuff. Thank you so much for your time and your energy.